Progel Pleural Air Leak Sealant is the only sealant FDA approved and clinically proven to treat air leaks and reduce hospital length of stay. Progel Pleural Air Leak Sealant is a single-use device intended for application to visceral pleura after standard visceral pleura closure with, for example, sutures or staples, of visible air leaks incurred during resection of lung parenchyma. For full prescribing information regarding Progel Pleural Air Leak Sealant, Progel Applicator Spray Tips, or Progel Extended Spray Tips, including indications, effects, routes, methods, frequency, and duration of administration, and any relevant warnings, contraindications, side effects, adverse events, and precautions, please view the information included at the end of the video, as well as the instructions for use included with each product. Progel Pleural Air Leak Sealant Instructions for Use, Part 2. Sealant Application. Step 1. After applying standard suture or staple closure methods to seal identified air leaks, assess for persistent visible air leaks from the visceral pleura. Step 2. Rinse the visceral pleural surface to be treated with sterile saline to remove any pooled blood or blood clots with irrigation and/or suction. Step 3. Blot the target tissue area with a sponge or gauze to remove any excess moisture. For best results, Progel Pleural Air Leak Sealant should be applied to a clean, dry surface. Step 4. Ventilation to the affected area should be stopped. If ventilation needs to be maintained, reducing the tidal volume is recommended to minimize air leakage and lung movement during application of the sealant. In procedures where CO2 insufflation is being used, consider reducing or discontinuing CO2 pressure during Progel application and for the duration of sealant set time. Step 5. Keep the applicator tip approximately 5 centimeters or 2 inches away from the target area during application to avoid creating bubbles in the sealant material. The formation of bubbles may compromise the adherence and mechanical properties of the sealant. Step 6. The unique patented design of the standard and extended spray tips allows for Progel Pleural Air Leak Sealant application as a stream or a spray. Minimal pressure applied to the push rod will yield a stream, ideal for targeted application along staple lines or sutures. Increasing pressure applied to the push rod will yield a spray for application to larger tissue surfaces. Step 7. Maintain firm pressure on the push rod and move the spray tip from side to side along the margin of the tissue surface to be sealed during application. Interruption of application for approximately 10 seconds may result in occlusion of the spray tip. If occlusion occurs, remove the spray tip, wipe the end of the applicator to remove any fluid, and attach a new spray tip. Step 8. Progel Pleural Air Leak Sealant will begin to form a strong, flexible hydrogel within 15 to 30 seconds of application. For best results, the sealant should be allowed to set for a full 2 minutes after application before irrigating or performing a submersion test to reassess for air leak. Progel Pleural Air Leak Sealant is the only sealant FDA approved and clinically proven to treat air leaks and reduce hospital length of stay.